Now, in 3 days, exactly on Tuesday, the 4th of February, humanity will mark World Cancer Day as a way of keeping the focus and relevant conversations around the dreaded medical condition. The theme for this year is United by Unique. In Nigeria and other middle-level countries in the global south, cancer is still practically regarded as a death sentence because of the cost-intensive reality of treating it and managing it. Finding a cure for cancer is also proving a bridge too far for humanity, though there have been many false dawns. Now, joining us now to discuss the message and significance of this year's commemoration of World Cancer Centre and whether or not Nigeria is making the right moves is Dr. Muhammed Habeebu, who is the Chief Clinical Coordinator at NSIA-LUTH Cancer Centre right here in Lagos. Good morning and welcome to the morning show.
Good morning.
Well, as
Good morning, Doctor.
Thank you for having me.
Welcome. You're very much welcome. Well, as we had in the introduction there, unfortunately, even though we do hear information that people shouldn't regard cancer, especially if early detected, as a death sentence, there does seem to be the reality for many people in the developing world.
Yeah.
So when we're looking at Nigeria's so-called war against this disease, how do you think, in general terms, Nigeria is faring?
Well, we are making great steps to improve in how we care for cancer. However, we still have a long way to go because most of our patients still pay out of pocket, and the awareness about the risk and the early detection is still not being met. So even though the government is improving by refurbishing and equipping the cancer centers in the country, like my own cancer center, that's the NSIA-LUTH Cancer Centre, has been greatly equipped and personnel have been greatly trained. However, government is trying to replicate this in the 6 geopolitical zone, but we still need to do more about insurance funding and the knowledge of cancer by the people.
Mm. All right, Doctor. So what should Nigerians expect on Tuesday, February 4th, when, the World Cancer Day itself will be celebrated? I know that the whole point of having a World Cancer Day is to raise awareness, is to speak to the theme, for this year, every year. What will be the role of government? What will, your center be doing? What should be the expectation? Or is it, an annual, ritual that, it's World Cancer Day, let's talk about it?
Yes, like the theme, United by Unique.
By Unique.
The theme is about taking knowledge of cause of cancer, we call it etiology of cancer, the knowledge of early detection, that's the importance of early detection, the knowledge of how to diagnose it, the knowledge of the availability of treatment modalities in the country, and more further, we will need to also improve the source of support for the treatment. So on that day, we are going to enlighten the people, both the patients and the ordinary people who do not yet have it, so that they can detect it early, they can know the cause and know how to prevent it as much as possible. So the knowledge of prevention is also very key, because if we're able to prevent it, we won't have it in the first place. And then the knowledge of how to know that it is cancer so that you can present early, the knowledge of where you present to, and this will greatly shift the outcome of treatment if we diagnose it. Then later we can follow up with having insurance that are robust enough to fund this treatment so that the payments will not deter patients from presenting, and this will greatly improve the outcome of treatment.
Absolutely. For people who unfortunately already have been diagnosed with cancer, I can imagine that there is also the personal journey that they have in terms of their health, their fight for survival. But for the people around them, what advice can you give to people who may not have the experience of dealing with a close friend or a family member with cancer? What knowledge do you think should be given to them? I say that because myself and my colleague Leila Johnson-Salami, we're currently actually putting together a report on the importance of sugar, and perhaps importance isn't the word, but rather the risks associated with sugar, most especially for different chronic diseases. and there being a link between high consumptions of sugar, post-diagnosis of a disease like cancer, and perhaps adverse health conditions. So with that, in us working on this report together, we have found and spoken to people who say that perhaps a loved one that they know is going through chemotherapy treatment, and their wider community would want to give them sweet treats, cakes as a I'm sorry, or these are you're in my thoughts, but perhaps having no idea that sugars, processed sugars, are the last thing somebody who's going through chemotherapy should be consuming. So examples like that, what can people in the community do to support adequately somebody who is dealing with cancer?
Yes, the people in the community should have a strong knowledge of pros and cons for the patient. Sugar particularly has not been universally accepted to worsen the prognosis or outcome of treatment. For patients who are end of life, that's patients who are on palliation and we can no longer treat, we will not want to restrict any sugar or anything for such a patient, because we want the best quality of life for those patients since they are already going. So we won't restrict. However, for patients who are not in that phase, we just would like to preach moderation. Whatever you take it in moderation. But it has not been scientifically proven that sugar worsens it. But you can take things in moderation, and it will not really confer poor prognosis.
Doctor, how do you think that in celebrating or in acknowledging this year's World Cancer Day, the breakthrough in Russia on the mRNA vaccine that Russia announced that they have discovered, that can work well in personalized management of cancer globally. How do you think that will become a subject of debate, if not celebration? Or should we accept that because it is Russia and not United States or UK or France or Germany, people should be hesitant? I consider, of course, that in terms of data and peer reviews and stuff, information available is still low. But then Russian government is saying that we have hit a breakthrough and that the world should acknowledge it and possibly celebrate it. How is the industry, taking what Russia claims it has discovered? Well,
for any discovery anywhere in the world, especially from a Eastern Europe country like Russia, which we know they are very developed too, whatever they say, we need to be investigated. Once there's a discovery like that in medicine, it takes a long time before it's generally accepted, because when you make a discovery, then it is tried again by an independent body to see if they will achieve the same aim. And it is recorded. What you say is recorded and verified before we all now start using it. Cancer is not a single disease. There is a group of similar diseases. So it will not be, it's not generally acceptable that just one discovery will treat all cancer. There will be categories of cancer that mRNA may be able to treat, but however, it has not been verified. It needs a verification by an independent body before we all then take it. But it's taken seriously.
Yeah, but because people might want to ask who verified the vaccine that Russia produced for COVID and that China produced for COVID, but their citizens use them, and claim some positive results the same way that people in America and other parts of Europe and Africa, of course, Asia, use the vaccines that came out of America and Europe. So my question again is
who verified?
Exactly.
Yes, in terms of COVID is slightly different from cancer. During the COVID, there was no treatment for COVID. There was so any treatment that came, they bent the rules to try it because there are no treatments. But for cancer, there are standard treatments. So once there's treatment, whatever discovery will have to be compared with what you already have. It has to be at least as good as what you already have before the medical society takes it. It should be as good or better than what is already on ground before the medical institution adopts
But there's no
it.
vaccine on ground at the moment.
No. Where there are vaccines for different types of. There are a few vaccines. For example, there is vaccine for cervical cancer.
Okay.
There are some cancers that have vaccine, but it's not much.
Okay.
We just have a few selected cancer that we can do vaccine against. But there won't be vaccine. It's not likely that there will be vaccine against all cancer, like I said earlier, because cancer are of different mechanisms. It's not. They are not all one. There are varieties of cancer with different mechanisms, different part of the body, different pathogenesis. So we can't have one cure for all.
So cure may still be
Yes.
far away.
Well, cure, you mean prevention, vaccine prevention, because there is cure already for early discovery for most cancer.
Okay.
It's only when it is advanced, we say it's metastatic, it has spread, that's when there's no cure.
Okay.
Yeah.
Well, Dr. Muhammed Habeebu, thank you very much for this really insightful and very important conversation here. We really do thank you for coming over. Actually, I know we're running out of time, but I do know that, so for example, here in Nigeria, we're the most populous country on the continent. We do know that for cancers that affect men, for example, prostate cancer, it does really affect black men, African men. So in terms of early detection, because we know that it's so important, how can you advise men to, even without any symptoms, get up and go to the doctor? Is this something that it can be requested at a routine checkup? How can men protect themselves in this way?
I think...
Thank you.
You're welcome, Steve.
Yes, prostate cancer is what cancer that is easy to cure when detected early. I must say that we are seeing men come in for screening more than before, and we are catching them earlier than before. Like the records of where I work, we are seeing those stage 1, stage 2 now on like a decade ago. However, it should be well preached that prostate cancer can be cured if you get it early, and it's easy to screen for it just through blood check. Look for the prostate specific antigen, we call it PSA, and once it's rising beyond 4, you start monitoring. If it's significantly increased, then you do further tests to check if it is prostate cancer or the benign prostatic hypertrophy, which is the benign form of it.
So PSA is recommended
PSA
as a yearly.
Well, as a yearly, if it is below, if it is not above normal.
Okay.
Once it's getting above normal, then you have to increase the frequency so that you'll be sure of when to investigate further.
Thank you.
Thank you very much.
You're welcome. Thank you for having me.